Thank you for having me, first of all. And just ask you a few questions, have a chat about chiropractic because, look, being in the exercise science, nutrition science world, I hear a lot of things. There's a lot of claims that are thrown my way, a lot of misconceptions. And so I wanted to kind of pick your brain. Tell me, in your definition, what is chiropractic care?
All right, so chiropractic care, from a basic perspective, is the restoration of optimal spinal health. So one, you have the actual alignment of the joints in your spine, because you have 24 movable joints.
Right.
And you need movement of your spine to live your life.
Gotcha.
It's a pretty simple concept.
Right.
Now, when that happens, it actually has an influence on your nervous system. And so when we talk about the nervous system, that kind of controls everything in your body, right? The nerves go to every cell, every tissue, every organ. And so when you have right movement, right alignment, optimal alignment in your spine, then the nerves kind of can flow optimally in that regards. And so my job is to help with that nerve restoration and proper alignment.
Like the vertebrae, the spine, is surrounding this very special thing called the spinal cord.
I mean, it's got to protect it.
Yeah, and so what is the spinal cord, right?
The spinal cord is the central nervous system.
Okay, yeah.
Right?
And that's where it branches out to every other part of the body, right?
I do something called the Gonstead technique, and it's very specific. I will even be so bold as to say it's kind of the gold standard of full spine technique. It is not just back pain, and if you were to walk into a clinic and all you do is just lay face down and crack, crack, crack one way, flip over and crack, crack your neck the other way, and on your side crack, other side crack, that's not good chiropractic care. That is not quality chiropractic care.
Right.
You are looking for specificity. You're looking for somebody who actually examines the spine. You know, I said the spine moves, right? Well, let's move the spine and figure out where the issue is. X-ray analysis. I listen to what is called your case history of what actually is, why are you coming in? And then when you understand the mechanics of the spine, you can kind of understand, you have a better understanding of what could be happening to somebody like you coming in.
Right. What is chiropractic care? What is it not?
Ooh, that's a good question.
Yeah.
That's a tricky question, and I'll tell you why. Because of the influence on the nervous system that it has, I have had people come in with heartburn that they've been treated with by medical doctors and pills for 4 or 5 years. In 2 months of care, they're like, hey, I can lay down sleeping on my back. Now,
so it's kind of hard to, like, with confidence say, like, it doesn't do this, this, and this. Or it does do this, this, and this. Like, so it's, you don't want to, like, step out of your realm and say, like, hey, I fix this. Because that's one thing that I see, and I guess that was the main really thing I was trying to poke at. I see a lot of chiropractors making a generic claim like, I'm going to cure your irritable bowel syndrome.
That's dangerous. That's dangerous. The body does what it needs to do, and usually there's a reason for it, whether it's overproduction of something or underproduction of something. And if you can help the nervous system, then you can get better. But unfortunately, sometimes that doesn't happen. Now, most of the time it does, but it's a dangerous claim. It really is.
I get that.
The one thing I can claim with absolute certainty is optimal spinal health, alignment, and nervous system pressure. That is what I'm going to 100% claim.
What's something that you want to bring to the table here at Cross Chiropractic that might not necessarily separate you from other chiropractors, but like, what is something that you feel is beneficial and valuable to your patient?
First off, the technique I use, nobody does it here in Spartanburg. Right? And extremities. I work a lot with extremities. My experience of my knowledge of how the spine works, how it moves, and how the extremities move, right? I can relate to people like you who come in with, hey, I just did a hip thrust and RDLs. How many other chiropractors do you know would know what that means?
Probably not a lot.
And so my knowledge of the movements of the workout and the movements of how the spine's supposed to work, couple that, and I can say with a good bit of confidence that I can help people.